For the folks who are just joining, we've got a large number today, so I think we're going to handle most of the speaking. That said, we'd love for you to introduce yourself if you're open to that. So if you want to, go ahead and drop in the chat name, license type, location, and your favorite Colorado summertime activity, since spring is among us now and summer will be here soon. Thanks everybody for joining. This is Althea's Colorado launch. We're super excited about what's going on in Colorado. We've gotten to work and help support with the things that are going on in Oregon, and really just couldn't be more excited that Colorado is now opening the program and to see all of you and all of the great work that you guys have done. For this webinar today, we are going to record it so that anyone who can't join today has this accessible. One of my co-founders, Sarah, she's going to be monitoring the chat. And so if you've got any questions, throw those in the chat and we'll get those answered either during or as part of the Q&A towards the end. For those that don't know me, my name is Andrew Conley. I'm a co-founder and COO of Althea. I'm the lone team member who's based out in Portland, Oregon. My background is in healthcare technology, as well as Niko's and TC's. Previously worked at Epic, and I've been a longtime supporter of psychedelics. I'd like to just say congratulations to everybody that's been putting in effort in Colorado to make this happen. I know that it's been a lot of people that have worked really hard to get to this point. So I think that as you know, we've had facilitators licensed, we had the first center license last week. It's a great moment to just remember how far we've come, even though it feels very much like the beginning of where we're going here. And we're super excited to be a part of that. It makes me think of this quote from Terence McKenna about the milestone before us. There's still a lot unknown about the path forward, but courage will be rewarded, and at Althea, we're here to help support along the way. This is more for the intros, dropping in the chat. Our agenda today, I'm going to kick it over to my co-founder Niko here in a second, and he's going to talk through who's Althea and give a background of our story. After that, he'll hand it back to me, and I'll do a software demo. So we'll take you through the software, how that works. After that, we'll talk about client matchmaking. So we've got folks that are coming inbound who are looking for psychedelic services, and we're helping them navigate that path. We've also started the Forward Fund. So one of the barriers to entry with psychedelic services is the amount of funds it takes to actually participate in a journey. So we've started a fund to help with that, how you or folks you know can apply for that or contribute to it. And if we've got time at the end, we'll do some discussion and Q&A. With that, I'm going to hand it over to my co-founder, Niko, to kick us off with the Althea story.
Cool. Thank you, Andrew. Yeah, I'm Niko Skievaski. I'm so excited to see so many friends on the call, and for those of you I haven't met yet, I'm excited to meet. And thank you for some of you for being on Zoom, on video too, because it's nice to look at faces while I talk rather than just looking at Andrew. I look at him enough. So appreciate that. Andrew, I'll give you the signal when it's time to change the slides like this. That was the first one, by the way. Okay, so who's Althea? First and foremost, we are a public benefit company that was founded about a year ago now, so we're fairly new. But we came together around our love and belief in the power of psychedelic medicine to really heal, and we've all experienced that personally. And yeah, wanted to figure out what we can do to help support the space. As Andrew mentioned earlier, many of us have a healthcare technology background, and so we are not facilitators. We are not the people who are holding space for people who are going through this healing. And so we thought maybe with our background and with our abilities, we could help out in other ways. And so what we decided to do is try to see if we can make software to help. And so first and foremost, we create infrastructure for practitioners, and we'll get into that today. around the software aspects and other tools that are available to help practitioners in this space. We are strong believers that the regulated space is an amazing opportunity for people who would not otherwise find psychedelics or who might be a little more cautious around psychedelics to find their path into the medicine. Most of us found our way into the medicine in the unregulated or underground space, but that's not for everybody. And we joke around at Althea that we didn't build this for ourselves; we built this for our parents, because it's really our parents who we would love to see find their way to the medicine. I was lucky enough to have an experience with my dad right before he died, as he was facing his cancer diagnosis, and being able to sit with him while he grappled with his diagnosis and the rest of his life was a really big inspiration for me to figure out, like, how do we actually create more of those opportunities for people who wouldn't have otherwise found that path. So that was a big motivation in my life. Um, as I mentioned, we started with software. So last year we started rolling out software in the Oregon market, in the legal regulated space there. We have about 40% of we estimate about 40% of the journeys that are happening in the Oregon market now are documented in our system, which is amazing because we're able to see the impact that it's having on so many lives there, which we'll be able to show you some of that as we get into this. But as we were working in Oregon, one of the insights that we found was that, uh, yeah, software can help. It can help make it a little more smooth and help people stay in compliance and a little more organized. But the biggest challenge that practitioners were facing in Oregon wasn't keeping their books straight. It was really figuring out how to get more clients. And so we made that part of our mission starting earlier this year. This is a picture of us at South by Southwest, literally signing people up to do psychedelic journeys in this regulated market. And so we have expanded into what we call psychedelic care navigation, which is just a fancy way of saying we're trying to find clients for all of you. And then based on the insights that we're getting from how people are practicing, actually match up clients with practitioners, the right practitioners for them, based on their preferences, based on their needs, and everything that they're looking for. So as Andrew mentioned, he'll get into that as well. So we have been hard at work getting the software ready for Colorado, while we have been running in Oregon and helping service centers there and facilitators there stay in compliance. The Colorado program is a little bit different, right? We have a clinical facilitator model versus a non-clinical facilitator. We have slightly different rules. We have different documentation that needs to be captured, different forms. I don't know if for the licensed facilitators on the line, I'm sure you're looking at the fat stack of forms that clients need to review and sign. That is a big part of the process that we take care of in Oregon. That is the same but very different in the Colorado space. Yeah, so we're going to get into all of that, but wanted to give a background on who we are, and just to go a little bit deeper into the weeds of all of us here. So you met me, you met Andrew. I want to give Sarah the floor to say hi as well. She can just pop over because we're here.
Hi, everybody. I'm Sarah Bates. I'm also based in Boulder, Colorado. And like Niko and Andrew, my background is in health tech, but I come from more of the engineering side of things. So yeah, I run product and technology here at Althea. So you'll see me, hopefully it doesn't happen too much, but if anything goes wrong, or if you have ideas for what you'd like to see, I'd love to hear from you. I'll also be in the chat, so you might see me if anybody has questions. I might be answering questions, and yeah, I think that's me.
And Sarah's serious. She loves product feedback. So as you get in there, or even as Andrew demos the product, if you're like, hey, I wish I worked this way versus that way, like that's sort of the fuel that that guides her. A quick touch on some of the other folks on the team that you might interact with as you're working with us. Lex is our psychedelic care navigator. So she is a She has a background in integration coaching and microdose coaching and working with clients who are, on their journey. And she's on the team really to talk to folks as they're coming in and trying to figure out how to find a facilitator. So she's the one who's often matching folks with facilitators, and really working with clients to figure out, are they ready for a journey, or are there other things that they could be doing along the way? And she's based in Denver. And then TC is one of our engineers who's really focused on the technology side. So, and he also helps out if you find bugs in the software. So you could interact with him if you're experiencing bugs, which happen sometimes. And then Scott, we affectionately refer to Scott as our adult supervision. He is a researcher, neuroscientist at the University of Colorado Medical School in the psychiatry department. And he's actually putting in an IRB right now. So we can actually enroll people through the software in a clinical trial looking at real world evidence around psilocybin use. And so as Oregon has implemented this program, and as Colorado implements this program, other states are looking at what we're doing here to figure out, is it working? Is it effective? And gathering real world evidence is really important to drive policy nationwide to really improve access. And so we think that's a really important aspect of what we're all doing here, is living an experiment that we can use to show that psychedelics are effective and safe in this type of administration. So that's a quick overview. Now we get to get into the juicy stuff. So I'll pass it back over to Mr. Conley in Portland.
Sweet. Thank you, Niko. Whoops. Cool. Before we get into actually doing the demo, let's just go over what Althea is a little bit. It's a care navigation platform, and what that means on your side as facilitators and centers. Here's some of the things that it can do. So it can do client management. So this is easily in one place, staying organized with all of your clients or patients from preparation all the way through integration and beyond. And so we've got statuses that help you track exactly where you're at and figure out what needs to happen next to move people through the process. As part of that, it also helps with compliance, so you can easily send and share forms with clients, with facilitators and healing centers. So this is something we've been doing in Oregon that really helps make this process easier, because there's a lot that goes into it. Having something that's streamlined, works well, it's easy for clients, saves a ton of time and headache from what needs to happen to make sure that this stuff works smoothly. We also have safety screenings and outcomes tools, and we'll go through those a little bit as well. We worked with the PPPP, the Psychedelic Public Policy Partnership, whose team from the University of Colorado, to put together a risk assessment tool. And we've got questionnaires that can help during preparation and integration to help people prepare for their journey and measure outcomes afterwards. And lastly, this tool is built with the utmost privacy and security in our minds. We're TC, Niko, and our background is working at Epic. We're very familiar with electronic health records and what it needs to be safe and private and compliant with HIPAA. And we've built it into the spirit of HIPAA at that level. HIPAA doesn't apply here as it's a federal regulation, but we like to think that we're at or beyond what we need to be if those regulations were to apply here. And before we get into it as well, we've learned some lessons in Oregon so far as well, and it affects it's been input into how we've designed this software and how it works. And one of those things is, in Oregon, facilitators work with multiple centers, so folks aren't tied. It's not it's more of a contractor model than an employee model, and people kind of float and go to different centers depending on various factors: who they like to work with, what spaces they like, how big of a group they might be doing, those types of things. And so you'll see in our software how we allow for that ease of floating. Also, clients are brought in from both facilitators and centers. So this is something we've seen in Oregon and expect to see in Colorado too, that that work of bringing in people will fall on a bunch of different people. We've also learned that state training programs are great, but they should be considered just the beginning of a long training trajectory of learning of how these things work well, how to improve it. We think that there's a lot we're all going to learn about how things can continue to be improved, and as new states roll out, that they can stand on the shoulders of those who came before them and learn those lessons. And we're hoping to help contribute to some of that learning as well. And lastly, that we've only scratched the surface of potential demand. I think in Oregon, maybe about 10,000 people have gone through the program. That's been going on for about the last 2 years, which is awesome. That's a really cool number to have hit. But we believe that there's a lot more people out there that are interested in this, that could benefit from this, that actually want to do this, that aren't aware that these programs yet exist. And so we think that there's a lot of opportunity there. On that feedback front, these are some of the generalized aggregated outcomes that we've collected in Oregon. We've had a good number of sessions that have been completed in our software, and with really positive outcomes here. So we can see that the majority of people have found this to be very, very safe. It's been an experience that's overall enhanced their well-being. And it's something that they've really would recommend this psychedelic experience. They'd recommend their facilitators to other folks. So this is all really, really encouraging stuff. And I think that if you talk to anyone in Oregon, they'd say the same thing too, right? This stuff works. People are having really positive experiences with it, and are having really lasting outcomes. Okay, we're getting ready to get into the software. And right before we do that, let me just give a structural overview. So in our software, we have what you'll see are called sessions. And this is everything related to an administration session. So this is going to include prep, admin, and integration, which are all kind of smaller sessions that happen in there. And so when we think of sessions, it'll just be kind of that greater umbrella of sessions. In our software, we've got clients versus sessions, and this allows for a couple of cool features that we can do. The client record is unique to each facilitator. So there might be, a client could work with multiple facilitators over the year. They would have a unique record with each of that facilitator. And that's really the homepage for the facilitator to keep notes in an entire history of a client that they've worked with. That client record is not shared with the center that they're working at. So this is one way that we allow things to stay private. So if there are notes about a client that you don't want shared with the center, that's your homepage. You can keep all of that stuff right there. On the flip side, the sessions are shared with the centers. And so, one thing we've learned in Oregon is that cutting back on the communication back and forth, as soon as you schedule a session at a particular center in our software, the service center or the healing center admin can see that session information. There's a lot of information that they need to know and track that's in there, so that we make that happen very easily. Also, with having clients versus sessions, we can have a many-to-one relationship. So if you work with a client over and over, have different sessions, you can track that and see all of their different sessions. As I mentioned, this allows facilitators to work at different healing centers, and it allows admins to very easily see all of the activity that's happening at their healing center. Cool. Let's hop in. Give me just a second. I'm gonna have to figure out where my screen is. Okay.
Your screen's on your computer.
Thanks, Niko.
Brilliant.
There it is.
Helpful as always. You know what? I'm going to move this real quick. Okay, can everybody see my screen now? Seeing some head nods and thumbs up. Cool. Welcome to Althea. So right now I am logged in as a facilitator. I'm on my homepage and I can see the statuses of where things are at. So I can see I'm currently working with 6 folks that I'm preparing for an administration session. One person who has completed all preparation steps, but hasn't had an administration session. We've got 4 folks that have been completed here. I'm going to walk through kind of the high level things here, and I'll start by just walking through creating a client and walking through a session. I can come here and I can see all of my list of clients. I'm going to add a new client. Since we're working in the great state of Colorado, we'll throw in John Denver. I'm not sure what John Denver's mother's name is, but we'll just do this. Cool. So I can create a new client and put in some high-level info about that client. I actually don't think John Denver is actually from Colorado. I just wrote a great song about it. So I'll add this in as a high-level note here. In the middle, I can see that I have a log of all the sessions. Since this is a new client, I don't have any sessions at the moment, but we'll create one here. Down below, I have the opportunity to track notes. So I can put in notes, save, and we would just have a running list of time-stamped notes that I can keep down here. And I also have the option for a document repository. So if I wanted to upload documents and keep with the client, I can do that here. I'll show you in the sessions how we handle more of the state-regulated documents and some of the questionnaires we send. This is the client record, which I have access to. And I'm going to go ahead and schedule a session for John Denver. So we'll use the Althea Healing Center. And I'll schedule out, we'll say John Denver's date is going to be, his administration date will be here in a couple of weeks. You can see here, I also have the ability to do this, make this an individual or group session. If I were to make it, I could toggle to group here and I could come down to add, and I could add other clients into this. So I'd have to create those client records, but I could easily expand this and make this a group and track people through that process that way. Cool. I've clicked create session and we can see some of the details up here and I can edit those. And down here, we've got everything that goes into a session. So we've got 3 tabs that I'm going to take us through: preparation, administration, and integration. And this is where bulk of the features exist of things that we can do and log and send our client and make sure that we're staying compliant and track them through the process. I can add a prep session and log notes here. Let's go ahead and do that. And so I can get a running list of any preparation sessions I have. Similarly, on the integration tab, we have that as well, so you can collect those types of notes. We've also developed some questionnaires. We've got a baselines survey and a safety assessment screening. For our baselines survey, we are using validated medical screeners that measure well-being, depression, and anxiety. And we can collect some baseline level information for the client to just get a sense of where they're at. So this is surveys I can send to the client by either copying this link and sending to them, or I can click send questionnaires here. And this will automatically send them an email with this information. I can toggle what I'd like to send. And what we'll do is you can measure this ahead of time and you can measure it afterwards as well. We put together a little report showing what this means, how this data is relevant, and how you might want to use that to help your client as part of preparation and integration too. As I alluded to earlier, we have a safety assessment as well, and this wasn't something that we built, but a team of researchers and doctors and professionals at the University of Colorado put this together. I believe this is going to be the suggested or encouraged form that Coloradans, the program that Door and Door would like folks to use. It's pretty thorough, collecting medical information and history. And similarly, we put together a report on this as well to say, are there any red or yellow flags, things that should be gone over and talked about to make sure that someone is as safe as they can be before going into a psychedelic journey. We can see with John that we're in the preparing status. And what that means is the system is waiting for all of the required checkboxes that are checked. They're waiting for that to be completed and a document to be listed with it before moving, before saying ready for preparation. And so this is really where the facilitators have the ability to decide, well, what do I want to be sending my client? One note here, so we're going through the Oregon setup at the moment. Right now, we're waiting on the finalized Colorado forms. So I'm using Oregon as an example, but it'll work very similarly when we have the Colorado forms finalized and up and running, which should be quite soon. So what we've done here is we've defaulted the required ones for the ones that are always required. These are sometimes required, but the facilitator can come in here and decide which ones actually are required. And so in this case, they might say, well, I might need an interpreter or a support person, so I'm going to make this one required too. So folks can come in and say exactly what they want to send out and make sure that they've got the right paperwork as part of preparation. I'm going to go ahead and send these questionnaires. And what's nice in the system is we can see that that sent date. So as we're kind of tracking things through the process of making sure that things are getting filled out, we know, cool, this was sent at this time. Similarly, I can look at this here and it's going to double check. Do you have the right form selected that you want to be sending? And down here, we've got this great feature where we can pre-fill some information in these forms. So what's really cool about this process is, first off, some things are already pre-filled. So we know the client's name and the facilitator's name and the center that they're at. So this type of information gets pre-populated to cut down on what the client needs to fill out. And similarly, we can add in some more details here. So if before sending this out, you know already what these plans look like, you talk through that with the client, you can pre-populate this. This cuts down on some of that back and forth. And if you haven't filled that, haven't discussed that, that's okay as well. We'll say that the client is staying nearby and they're just going to walk back, that they don't have support plan. And we can just put some doses in here that we've discussed. Cool. We click send, these documents go out, and the way that this process works is these will go out to the client for review, filling out and signature, and then they'll go to the facilitator for review and signature. Once all of that's complete and they review those together, these get uploaded here, and you'll see that they get marked as completed, and they'll have a document in here too. And I'll show you in a minute what that looks like when someone's actually completed all of this. For administration, it's a lot simpler. We're just collecting a few details after administration. So we're collecting some of the medicine that was used, start and end time, and if there was any type of adverse event or not, or anything you want to log here. So we'll have that information. With integration, like I mentioned, we've got session notes, so you can log all integration sessions and notes related to that. We've also got some outcomes questionnaires that we schedule automatically for folks. So we have the mystical experience questionnaire, which we send a day or two after someone's journey for them to fill out. This can be a great tool to reflect on their experience and something that could be used as part of integration. And second, we have a feedback and outcomes follow-up survey. So the outcomes actually measures some of the same things that the baselines did. That will be the measuring the well-being, depression, and anxiety again, so that we can measure the before and the after, and see if there's any change there. And then it has some general feedback, things like how safe do they think they were. So this is some of the data we were looking at earlier. How beneficial was this? How well did they meet their goals? Some of those types of questions to help them do some reflection that can be helpful for integration too. If I go back, I'll show you what a completed session looks like. And we've got Trey Parker here. And we can see Trey is in the status of completed. And if I come down here, I can see that some of this stuff was completed. And we can take a look at some of these reports. So we put together these reports so that folks who are using this can make sense of what this looks like. So to measure well-being, for instance, we use the WHO-5, which is a validated medical screener. And we can see that coming in, Trey had a 32%. And we can say that, we have some general averages that this can be compared against. And so this might be useful. This might be something that's helpful for understand why someone's coming in, or what might be great steps to help them as part of preparation. Similarly, we do an evaluation for depression and anxiety. And in the future, we'd like to expand that as well to other reasons that people are coming in, and providing more tools that help collect and measure some information around that. For Trey, for the risk assessment, this is what that looks like. So our report that comes back is going to highlight some red and yellow flags, and then give you the spit out of all of the details here of a medical and mental health history, and highlight some of the things that you might want to be reviewing. So in this one, some medications that Trey is taking. So we're trying to give more information at folks' fingertips to make this easier, and make sure that people are feeling safe and trusted as they come through this. I'll show you real quick here that we have the reports, the documents right in there, so you can come in and see the signed documents. So you've always got access to those. This is where you can store and keep all of that information. On the back end, with the integration surveys we've got, we similarly send out a report on what the MEQ 30, what that result looks like. What does that result mean? What is the breakdown? And how does it compare? How does it compare against other studies that have been done? So you could use this potentially as a part of integration for sharing fun, interesting information with your client. And lastly, we've got the feedbacks and outcomes survey as well. So we've got some high-level questions. How meaningful was this to you? And then similarly, we've got the WHO-5 and a depression and anxiety measure as well on the back end. And in this one, we can actually compare the results of the before and after, which might be really important or interesting for the facilitator and for the client. Okay, that is creating a client. That's going through a session. That's some of what our reporting looks like. Let me show you one other view. So as my user here, I'm actually both a facilitator and an admin at a healing center. And so I can change context. And what you'll notice is I don't have, as an admin, I don't have a client tab, because as an admin, I would switch to facilitator if I was putting my facilitator hat on for clients I work with. But what's great about this is I can see there's a bunch of different facilitators here. So what I'm actually seeing is all of the session information from all of the sessions that are scheduled at my healing center. So I can see, high level, here's where we're at. Here's what's going on, here's what's scheduled, here's what's not. And so I can, help assist facilitators as things are going through, and make sure we're dotting our I's and crossing our T's. We can see we put little warning signs to say, hey, this is a session that has a date in the past, but it doesn't have all the documentation complete. So our goal here with keeping people organized around this is to help them understand where things are at in the system, and how to move things forward to make sure that everything's getting completed. As an admin, I get to control the facilitators that I'm working with that work at my center. So we have the ability, you can invite facilitators here. And lastly, we have some reporting. So in Oregon, they've got some data reporting requirements, and this includes some aggregated information. So this is something that we've put together to help make sure that they are staying compliant in that program. Cool. I think that's it on this front. Sarah, did we have any particular questions we want to go through now, or we can save that for the Q&A towards the end?
Sorry. Let's see. I've been trying to address most of the questions, and let's see. There's one from Melissa that I think we can talk about is ensuring confidentiality for clients. So we have very strict privacy standards here. So encryption and kind of all the same things that go along with all the HIPAA guidelines. We do that and then some. Do you have any specific questions about that, Melissa?
Well, one of the things I can add too is that we're also working on creating a way for clients to actually log in and see what data is available to whom, and help to manage some of that as well. I'm a big proponent of putting the power in the client's hands. Although some of the information that you're capturing around a client is, not necessarily shared with them. So your notes about their sessions or meetings you're having with them is really your data. But from a security standpoint, it's encrypted on the back end. It's secure, so no one should be able to access it other than you. And then we also, something that I think is quite unique to this space is that we have people like healing centers who actually need access to some information, but not all information. And that's really what Andrew was focused on around. The client record is your client record as a facilitator, where the session record is what's shared with the healing center. And that's because the healing center does need to have access to information for regulatory purposes as well. It's been awesome seeing the questions come up in the chat. So keep them coming as we go here, and we'll keep answering them or bringing them up in the discussion.
Cool.
Oh, Erica's got her hand raised. That's nice.
I just figured I'd go a different route. I was wondering if there was a way to print out some of our notes that we take during the sessions. I found that participants sometimes have a lot of things that come up for them during the session that may not make a whole lot of sense to them directly after, but may make sense to them later. And they've asked before, hey, can I have a copy of those notes that you took down during the meeting so I can process that later? Is there a way to print that out, be selective about the information that we do print out for our clients?
I
Yeah,
love that.
absolutely.
Good.
Sorry. Yeah, that can be super helpful. Yes, you can. So it would be as easy as going into a note. If you had a note that was kind of all of the administrative details, you could go in there and copy that text and print it out however you'd like to there. And you could, edit it if there's certain things that you wanted to include or certain things that you didn't want to, or clean it up before copying and printing that out.
And I'll just add to that, how Niko mentioned that we're building more of a portal for clients to access their own data. That's something that we can build into that too, where you can just, electronically share it. So it'll be a lot more streamlined.
I think that's actually better because I am a little worried sometimes about sending people home with those notes because they are so personal and where those notes might get lost, especially when they're not completely with it yet. So yeah, having them access that, be able to access certain parts of that chart is great.
Great. Yeah. Thank you.
Cool. Yeah, we're really excited for that too. That'll put the participant more in the driver's seat for their information and who has it, and like you mentioned, a more secure portal so that they feel good about what they're accessing. Cool. Let's keep going. We got a couple more topics to get to, and then we'll have a little bit more time for Q&A at the end as well. So next is client matchmaking. And so, Niko talked about this earlier. This is, and I guess I did a little bit as well, right? We think that there's even greater potential. We know there's a lot of potential in Colorado, but really just all over about expanding demand, right? I think that there's the proof is in the pudding. There's a lot of therapeutic benefits for a lot of different things that people are experiencing, and we're in a mental health crisis, and things are getting harder out there. So there's only potentially more people who are going to be affected, and psychedelics have been proven to be a really powerful tool that can help people spiritually and mental health, and with physical pain and those types of things too. And so we wanted to help promote this, help promote these legal programs. As Niko mentioned, there's a lot of people that have heard about this. They've read Michael Pollan's How to Change Your Mind. They've seen it on on Oprah. There's been some stories here or there, but they don't know how to plug in. And when they plug in, they want to do it in a highly professional and trusted capacity. They want to do it with licensed individuals in a legal way. And so we really want to help with doing that psychedelic care navigation to help those people find psychedelic services. And so that's really what this is helping those people do that. Yeah. So if you go to our website, which is withalthea.com, this is what you land on. This is our gateway for folks who are finding us to say, hey, are you interested in psychedelics? Where are you at on your journey? Do you need more information? So many people have so many questions about what this looks like. And ultimately our goal is to help them navigate that, understand the different benefits and risks, and answer their questions along the way. Lex, who's on our team, she's done a lot of coaching and psychedelic therapy for folks, and she can answer people's questions. And we're looking for more folks who have gone through this before. We think testimonials and people who can share their experiences can be really powerful for folks as well. And so our ultimate kind of our final step with this is matching folks with facilitators. And so our program allows anyone who's on this call, and we'll send out the links afterwards, you can sign up to be one of those facilitators that we match make with. And the way that works is when someone on our website fills out our Find a Facilitator survey, we collect some information on them as to what they're looking for, what kind of experience that they want to have. And on the other side, for our facilitators, we're learning a bit about them. What's their practice look like? What are your certs and experience? What's your flavor? What types of folks do you like to work with? And then we do a matching process, and we give them two or three options of people to talk to. And our goal here is to help these people find psychedelic services, to pair with someone who's a great facilitator, and to provide those services and make that match and make that work for folks. So if you're interested, let us know. And after the webinar, we'll send out a link that allows you to sign up to be a part of this process.
Okay.
I'll hand it over to Niko to talk about our forward fund.
So yeah, as I mentioned, the Althea has been an evolution, starting with software and then moving into figuring out how we can find clients for folks. As we've started finding clients, we hear the the barriers come up, right, around how costly this is. And in my mind, done correctly, it needs to be costly because facilitators are highly trained professionals who spend a lot of time with clients. And so inevitably that's going to cost money. But like most practitioners in the space, it's kind of heartbreaking turning someone away because they can't afford to pay for it. So recently we launched what we're calling the Forward Fund for Psychedelic Healing with our friends from Tricycle Day. And if you go to the next slide, it's really about improving access while at the same time paying facilitators fairly. So what this literally is a fund that we seeded and allow people to apply for funding through. And we use that funding to pay for their facilitator fees. We pay facilitators their standard fee, and the client will pay less than that fee. And sometimes it's fully covered, sometimes it's 50%. It basically replaces the concept of a sliding scale by allowing the client to pay on a sliding scale while the facilitator gets paid their standard fee. One of the things that we were seeing in the sliding scale approach was that based on based on human nature, if a sliding scale is offered, oftentimes clients end up on the lower end of that sliding scale. And what that means for a facilitator is that they may not be getting paid what they actually need to make ends meet. And so they bring the bottom of that sliding scale up to the point where the sliding scale isn't doing what it was designed to do, which is increase access for folks who aren't able to pay that. And so what we're able to do is offer that outside of the container that you establish with your client, and essentially offer them a lower price while keeping the price that they're paying confidential, so the facilitator doesn't even have to know what the client is paying. So we don't have to bring that financial conversation into that healing container. 100% of the proceeds in the Forward Fund are allocated towards paying facilitator fees. So we put some of our own funds in there to seed the fund, and we've also gotten individuals and other companies contributing to it as well. Contributors receive impact reports to understand where these funds are being allocated to. So there's some transparency around the fund allocation, while of course keeping the confidentiality around clients intact. To get into some details about how it actually works, when we designed the fund, we realized that it puts us in a position where we may have to pass judgment around who is actually worthy of receiving funding, which is a very awkward place to be. So we actually designed a system that took all of that off our plate. So we're not actually looking at someone's application and deciding this person needs it more than another person. What we're doing is having folks fill out two different assessments. One assessment is the financial stress score assessment. The second assessment is the WHO-5, the Wellbeing Index. And anyone who applies for the Forward Fund gets essentially one entry into a lottery. If they have higher financial stress, they get more entries. And if they have more challenges from a well-being standpoint, they get more entries as well. So it's a weighted lottery system, and then we run that lottery once a month. And so anybody might get funds allocated, but they have a higher chance of being allocated if they have more financial stress or are worse off from a well-being standpoint. It definitely puts trust in the applicants to honestly represent these things as they're filling out their applications. But in my opinion and in my trust of the medicine, if someone is being dishonest, then they actually should be going down this path and working with the medicine as well. So I just have trust that it'll work itself out. We also allow folks to pay it forward afterwards, and we're not talking immediately after the journey, but weeks afterwards, we see if they actually want to pay it forward as well. So if someone actually has the means to pay more, then they can contribute to the fund afterwards as well. So it's a trust-based model, and I'm happy to share that last week I was able to notify 3 applicants that we were going to take care of their facilitator fees, and so was really excited to get those first ones out there. And And we're still working on matching them with facilitators and helping them go through the process. But the call to action here for facilitators that choose to take part in this is, we if access is important to you and it's something that you want to work with your clients, if you have clients that might benefit from this, send them our way to apply for funding, and we can essentially take that sliding scale approach off your hands, and so you can hold steady on what your fee is based on what you need to make, and use this as a tool to still allow increased access. So yeah, just wanted to bring that up as well.
Cool. Thank you, Niko. Yeah, if folks have been thinking about something similar to this, we're looking for more folks that would be interested in partaking and being a part of it. We think that the more people that contribute, if we're working on this more together, then we can go further together. And we think that there's a lot of power in this and helping people improve access. And hopefully over time, as we're improving access via this model, we have more models down the road, and we have more accessibility for people in the future too. Okay, cool. We are getting to the end here. So here's the next steps. After this meeting, we will send out the recording and we'll send out onboarding instructions. So folks are able to start logging in and onboarding today. And one of the things that we generally recommend with onboarding is to set yourself up as a test client and to walk yourself through this. And you can see how that looks from both the client side, the facilitator side, the healing center side, and get a feel for how all of this works. We'll also share our contact information and options to get meetings on the books. We'd love to hear more about what you're doing in this space and how we can support. We'll also send out links on everything we talked about today. So client matchmaking and the forward fund. Yes, we'll give you all of that information. And as we get the finalized Colorado forms, we will also let you know. And we'll work on more meetings and videos, et cetera, to make sure that you understand exactly how that process is going to look. And lastly, as Sarah mentioned earlier, we are building the software for all of the great work that you all are doing. So we're so excited about Colorado coming online and everybody getting licensed, and for the first patients to be getting dosed. It's super exciting. If you've got feedback, suggestions, questions, whatever it is, we are all ears. We're here to build this to make this process as easy as possible for everyone. There's a lot to be done, and so we wanted to carve out this part of things and say, hey, we can help here. Focus on the user experience and all of the amazing healing work that happens, and let us support you in this way. Cool. With that, thanks everybody for coming, and we'll open up for any Q&A and discussion.
I saw Christine's question here asking about how much does it cost, and it's so funny because we didn't talk about that at all. It didn't even cross our minds. It's free. It's free for facilitators, for healing centers, for licensees in the space. That aligns entirely with our mission of trying to support the ecosystem with infrastructure. We make money when we are able to find you clients. So if we're able to find a client for you and get them hooked up with you, then that's when we make a little bit of money. And so that approach is really, I think, tied in with like helping the ecosystem. So we don't want to be a drain on the businesses that you're running and the work that you're doing. But if we can help grow them, then we're attaching our business model to that. Dana, nice to see you.
Thanks, Niko. Thanks for offering this. One, I'm totally interested in the forward fund. Two, will your system provide all of the necessary forms and documents that we need to stay compliant without having to go to a lawyer to get additional forms?
Yeah.
And And 3, will you consider adding other medicines to your platform, such as ketamine or MDMA, when it becomes available?
Yeah, I'll address. Ooh, I forgot what the first one was.
All the forms that are required without
Yes, so that
being a
was,
lawyer.
yeah, that was the second one, and the answer to that is yes. All of the draft forms that Dora has provided are in there. There are a few things that DOR has recommended regarding inventory, that kind of thing, that we do not do. So, but I think those are already provided. They're not like legal forms. They're like worksheets or something that yeah, the DOR has already created for you. But all the forms that they have provided the draft versions of so far are included.
And then one other question. I know that there's something, because I'll only be able to apply for a facilitator, not a clinical facilitator. And there's something about different diagnoses that I saw that a facilitator supposedly wouldn't be able to treat unless there's some kind of a waiver form. Will that be available?
A waiver form. Yeah, I think that's something that we can do. We have not yet. But yeah, if there's a need for that, absolutely.
Yeah,
Yeah.
and in the screening process, you'll be able to identify if your client meets the requirements either for a clinical facilitator or a sign off from a medical professional. And while we haven't figured out the workflows to actually implement the sign offs in the system yet, that's something that I think is as we all figure out how that works in the real world, we're all ears on trying to figure out how to streamline that process. It is an interesting rule in the Colorado market because I think the spirit of it is great, but the actual implementation of it will be interesting to see how it works out and what sort of providers are providing those sign-offs and stuff. And so, yeah, we're happy to keep the system evolving with these workflows, which is certainly what we did in Oregon as rules changed there, and yeah, and real world practices differed or were adopted. Yeah, so
Awesome.
we try to
Thank you
keep
so
the
much.
system evolving.
Yeah, evolving and also flexible enough that you can add things that are slightly outside of the norm. So if you do have a document that you've received from somebody that has that sign off, you can upload it as a document. So it's flexible enough that you should be able to kind of keep everything in one place. And then as we see what those look like, we can add them in.
I'd love to go back to the forms question a little bit too. So the idea from the regulators is that they have put out forms that are designed to protect the clients and participants in this model, and those forms are certainly things that we're implementing standard. There are agreements that you might want to talk to your lawyer about to protect you as a practitioner. These are like your terms of service, those sorts of things. So while the state is putting out forms that we will certainly implement, it might still make sense to have a contract that you have that you sign with your participants as well. And so it came up in the chat earlier around custom forms that are outside of the regulatory scope. And those are things that we're trying to figure out how to add into the system where you can have your own forms become part of that workflow as well. So that is something that's not there now, but should be coming in the months to come.
And real quick, let me jump in here. I know we're at time, so anybody who has to run, feel free to run. Thank you for everybody that's coming. We'll hang on for a few more minutes for some additional questions if people had time, but I just wanted to give folks an easy way to get out if you got to run and head to the next spot there. Yeah, let me piggyback on Niko's comments there and your questions, Dana. Yeah, I think the clinical versus non-clinical like routes or fork in the road, I think is one of the things we're most interested to figure out exactly how that's going to play out. And like Niko and Sarah said, we'll adapt the system to make sure that that's as easy as possible. We are hyper focused on psychedelics, right? This software is being built for these programs to make them function as best as possible. And so we're listening to that feedback and we're making changes to keep things up to date. There's been compliance changes in the state of Oregon. And so we've worked to make changes as necessary to keep everybody compliant and stay, we'll keep our finger on the pulse with how those things are changing and best practices too. And yeah, to your question about additional medicines. Yes, I think that is in the plan at some point when it makes sense to expand and to see what those programs look like and to be able to help in those capacities as well. Any other questions?
I love the peacock picture. Thanks, Christine. Oh, getting started with an account from Rose. You can sign up on our website under the facilitator page, and we're going to be sending out a follow-up email with some helpful links to point you all at those things. Hey.
Cool. Awesome. Well, if there's nothing else, again, congrats everyone on getting this far with this program. We at Althea are super excited about this, about Colorado going live. Yeah, and we're here to help. So just let us know how we can support, what you're interested in. After this meeting, we'll send out the recording and all kinds of links and information. And we're all ears. So just let us know. Thanks, everybody.
Thank you so much.